growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of the Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everybody, welcome back to the Lionhearted Dentist. Once again, I appreciate all of you that continue to download from Ireland to Brazil, Russia. It's pretty cool, and it's what inspires me to continue. But you didn't tune in this week to hear what inspires me, so let's get to it. What I want to talk about this week is probably my favorite topic to share and discuss with you. And I'm sure I'll go off on some tangents that have nothing to do with this topic, as I always do. But I'll try to stick to it. And this topic I love to talk about is case acceptance. And again, you've heard me many times over the last several weeks talk about these miraculous weeks we're having. And I would break them down and tell you the importance of the team, the importance of your clinical skill set. If you don't do any implant dentistry, then, we have a very different approach to the patients for case acceptance. And doesn't mean you can't be ultra successful. You can. But obviously your skill set has a lot to do with this. Case acceptance is everything, man. It's everything. So I don't know how any one of you, could ever walk into that moment of a new patient in your office and be nonchalant about it. I mean, after 40 years, it's still an exciting moment for me. Even if I'm not psyched up because I know I have a challenging patient, and by the way, I know that because I get as much intel on them as I can from the phone call screening that went on. So you may want to go back and look at that in early case presentation podcasts that we've done. In the very beginning, I spent like 4 or 5 different podcasts and breaking down case presentation, but it's something you can talk about endlessly because there's so many things that impact when a patient says, yes, I'll think about it, or no, right? And what you do every day, how this Monday is going to be for you. Is there going to be any moth holes? You're going to sit there because you have an hour and a half opening? Some of you will. Are you going to be sandwiching single crowns all day long into a maloccluded dentition that really has poor care in it? I mean, sometimes I do that. It is true. And I'd have to get specific with you. But what about if you went into not a day, but a week, a month, the next year of thought out, comprehensive treatment plans, maybe a phase 1 of several phases, hopefully to come with that patient's care down the road. Maybe a complete case that you're going to do from beginning to end, and a lot of things influence that. And what I want to talk about early today are a couple different things. The first is the red flags that impact what I'm actually doing or what I intended to do in this particular case presentation. And I'm going to back it up with different patients that I had this very past week and what was the outcome of the things I'm going to discuss with you. So the first red flag to me is, I want you to picture, hopefully you've embraced some of the protocols I talk about, because if you don't, it's really not going to be as effective. If you don't have the significant other person in the room on a patient that indicated a lot of need at the initial phone call. They reiterated that need when they came in alone, which is not what you want. It's astonishing to me how many of my colleagues don't embrace that just one facet, bringing the significant other And I know you're thinking, are you kidding me? I'm not going to ask them that. I mean, they're going to really show up at 11 o'clock with their significant other? We've been asking patients to do this at this stage for 30 plus years. I've told you over and over, I don't get 100%. I get about 70%. I don't know. I don't ask them, did you take off work to make it today? They just are there. And it's just like the getting paid up front concept, in my opinion. If you don't, one of the reasons some of you don't embrace that is because it sounds scary. Maybe you'll get rejected. Maybe that'll turn the patient off. I don't know. But these are everyday concepts and powerful ones when it comes to the end of the day of a patient saying, yes, I'll think about it, or no. So I'm going to assume that you have embraced that part of it and you have done a screen on the phone. So this patient knows a little bit about your office already. They know that you're going to look at their whole mouth. I mean, if you don't get past that, I don't think you have much of a chance to achieve the things that you hear me allude to. Or even bringing them in for that quick, right before they sit in the back operatory, or you can do it in an operatory if it's private enough, where your new patient coordinator re-reviews the stuff she asked them over the phone as for the screen. And you've heard me tell you why. You've heard me tell you that patients deny a lot in that first phone call to you. They don't always tell you the real condition of their mouth. So let's assume now that you're walking into the room. Okay? Stay with me on this. This is everything. And the first red flag to me, usually, is that they have awful something in the aesthetic zone. And when I say that to you, I mean they're likely missing a lateral incisor. I mean, it's gone, or a central incisor. You know, and this patient, by the way, has learned to control their smile so it doesn't show. I'm sure you have patients like this, you know, and it bothers them tremendously, but it's been there. And if it's been there for any time more than a couple days or weeks, that's a negative sign to me. That means I have to really work harder at this particular new patient visit and really ask questions that I don't always ask. So let me explain. You know, my initial questions to the patient are often this, and I want you to hear something really clear. I don't always follow exactly the same route when I'm going. I've laid out for you pretty much. I walk in, I find it very warm to say, hey guys, and I do say that, hey guys, where are you from? You know, and they'll tell me where they're from, or how did you find us? I love to start with one of those two. Usually I start with, how did you find us? Right? And then that tells me volumes right away. A lot of patients in my part of the United States, those of you that are from abroad, will almost say, are you kidding to me? Because I do brand a lot, because I can afford to brand a lot, because I'm in a rural area. And I've talked to you about this in other podcasts. You can't all brand equally and take the same road. You can't do it the same as me if you're in the dead center city of Chicago, Atlanta, LA, or a foreign country city. There are ways, absolute paths that you have to take to brand. When I say brand, of course, I'm talking about marketing. So I'll say, how did you find us? And a lot of times that will lead to a conversation. Like I worked on many of their coworkers or whatever it is, it always leads to good conversation. That's the takeaway right now. Okay. And then I'll often say to the patient, I don't always say this, but I often will say, so tell me something. What is it that had you pick up the phone and decide you were going to seek some dental care? What was going through your mind? Because it'll help me understand you if you tell me that. Help me know what your priorities are. Just like that. That's how you do it. Just like I said. And maybe they'll say, with the case I just gave you with the tooth missing, that they just have finally had it. That's a good answer. That's a good answer. Maybe they'll tell you that they just got dental insurance. That's a really bad answer. Okay, but they may say that. Like, we'll allow that patient who may have said that in the screen to still come in, because you never know where this is going. You don't. You know where it's going if they won't let you examine them, if they just want their one tooth pulled. But I may go through this process I'm sharing with you, and that still may be this patient's desire. And that's an incredible, frustrated Steve Rasner at the end of that visit. Because I find I can convince anybody of the value of oral health. Not even a beautiful smile, just oral health. So if they're missing something right away, I address it. I might say, can I ask you a question? What made you wait so long? I'm just curious, because it's different things for people. I'll talk just like that. Sometimes the fear prohibits you from doing anything. Now, I may know that patient's scared, and I've heard that answer before, and that's a good answer. So if they say it's fear, I like that answer. Sometimes they'll say the cost. I just didn't have it back then, and I'm in a better position today to deal with me. I've been taking care of my mother, my husband, my children. Common answers. So you are going to get people that you can get involved in comprehensive dentistry that have been walking around without teeth. But it's generally a bad sign, because what it shouts to me is some level of apathy. I mean, if you're willing to walk around without one of your front teeth, I think that's a huge thing. But it is sometimes countered with what I just told you. They've been prohibited by money, and now that's different, and really might be. Taking care of somebody else. These are all cases I've gotten before. Here's another one that requires a lot of work. You look in their x-rays, you haven't even looked in their mouth, and you see no significant dentistry. They're missing multiple teeth, usually in the posterior. There's no root canals. There are just fillings, usually really big ones. Now you see, that's probably the most dangerous patient that I come in contact with, or the most challenging patient. And I had one like that this week. I have notes here to share with you in a minute. Why? Because they have definitely gone to either good old Joe, and I talk about good old Joe all the time. That's the dentist that really never treats anything, does these gigantic fillings. Dr. Joe is apathetic about dentistry, let alone his patients. So I had a patient this week, came into me. The parameters I was given was he was 63, missing some lower left, lower right. Does this sound familiar? Doesn't have any gum issues he's aware of. These are my cliff notes I get. Has a broken upper left tooth, etc., and does have a history of perio and used to go every 4 months. And I looked in his patient's mouth, and he had all the things I just told you in terms of no significant dentistry. Why he even got quadrant scaling, I'm not sure, because he had lots and lots of problems. So think about it. What I would do with that patient, I hope this is helping you, because, this is the hardest thing to teach. I always start these conversations with the patient with, I want to let you know where you're at. And I proceed to tell them I'm fortunate that I love what I do. And you can say exactly that. If you've done it for 1 year, you can say that, because people want to hear that. And in my case, it's really easy. It's a really good thing, because I can say I've done it for 40 years. And I really love what I do, and I've taken just so much education in my career, I can never share it all with you. But the coolest thing I ever learned was a concept called what to do when. I'm talking to patients just like that. And what that means is we're in that moment right now. What should I recommend for Mike I don't want to overkill. I don't want to be good old Dr. Joe, and I'll explain what that is to them. I want to just tell you what it is I would do if I was you, if you could, given what's in your mouth today, given what I see on the x-rays. What I don't want you to do is waste money. Sometimes doing nothing, just doing nothing, is better than paying somebody a sum of money and coming out with nothing. Because the third patient you see, so I've given you a couple examples, no significant dentistry in your mouth, just awful aesthetics, or a terminal dentition. We all know what that looks like. Sometimes you have a patient that has multiple crowns, multiple root canals, and has nothing to show for it. They have maloccluded teeth. They have poor occlusion. They have horrible aesthetics probably. You know which patient I'm talking about. They have some level of gum disease. That's a patient that was treated myopically, meaning whenever he had a problem, and I share this with patients, this is not a good old Dr. Joe patient. This is, I never had a plan patient. And I will share that with a case with you in a second. And I use analogies. I said, what do you do, sir? And let's say he was a builder. I said, seriously, would you ever just show up on a site without a plan, get out a nail, a hammer, and some wood, and start? You wouldn't think of doing that. And you can carry that analogy to teachers, to cops, to lawyers, because it is true. Nobody of quality does anything without a plan. So that's why this information is so pivotal that we're sharing today. So because sometimes it's easy, right? They want an aesthetic makeover. And maybe you really can confine, they have beautiful gums and perio. They don't have any other pathology. Maybe they have just an ugly existing crown, maybe a little maloccluded teeth twisted, and you can fix that with 4, 6, 8 full coverage or veneer restorations. Yeah, and that's what they want. That's a beautiful life. It just doesn't happen enough, right? But what about these people that you have to convince in a non-selling manner that this is really a road worth going down? And that's why you hope they came to you today, because that is your reputation. Your goal, just roll into it. My goal, John, is not just to make you healthy when I'm done, whatever we're going to do. It's that you don't continue to have a litany of problems year after year. I know you have because I can see it. And you have nothing to show for it. Just another tooth that needs a crown, or a crown that needs a recrown. And really not the most aesthetic smile that we really could have achieved and still can. You know, it's like sports. You know, any of you that play tennis, when you have to focus, you have to be laser focused at the moment of what's going on, especially if you play doubles, what your opponent's doing, what your partner's doing, to really be a good player. And if you lose that focus like I do, you're in the wrong spot, you hit the ball improperly, and it really is a good analogy. If you're not laser focused to all these things that I'm talking about, if you just sit there and wait for the ball to come and then react, you're not going to deliver your best. And it's the same, quite honestly, it's the same in dentistry. So let me take you to that patient that came in later in the week. He's 68 years old. Now, I had an advantage with him because his wife came with him, and his wife was my patient. And she was one of the biggest cheerleaders I've ever had in the room. You know, we consider that. Is the person that we ask to come, are they doting? Are they on their phone the whole time? Often happens. Are they looking at me like they want to take my head off because I interrupted their golf game? That's a real story. So I turned to that guy that day and said, listen, please don't kill me. I know, because your wife told me, I'm interrupting your golf game. But this is a really good place to get dental care. And I really find that you'll make better decisions. You're only going to be here a little while if you make them together. And he could tell that I was sincere when I said that. And I did win that guy over, as a matter of fact. It certainly was more comfortable for me moving forward during that case presentation. But this gentleman came in and he had a mouth exactly like I've been talking about. Full of crowns, full of root canals, got ugly, a roller coaster, inverse curve of Spey. So here was my problem. I had a gentleman to pay a lot of money that's got nothing. He was a florist, by the way. He owned a floral shop. So I did go back to that analogy. I said, part of my analogy here. But if I called you up and asked you for some type of arrangement, a birthday arrangement, an anniversary arrangement, wouldn't that go into how you would present to me, what to give me? So I know you've had a lot of work done, but I don't think I need to convince you that you don't have a lot to show for it. It doesn't look like a mouth that I know you did because I see your x-rays and I see a history of 5 root canals. You know what that tells me? It tells me you waited too long. It tells me maybe somebody either didn't act quick enough or you didn't go to the dentist for a long time. One of the two. But I don't feel this mouth has had any continuity to the approach to fix it. And I am not here to sell you, man. Sometimes it comes out just like that. You don't have to say man. That's just my personality. I said, I'm not here to sell you. I'm really just here to tell you the truth of what I would do given what your desires are with your mouth and based on what I see. And as it turned out, it was an enormous case, like 30 grand. I couldn't do it, his particular mouth, for less because I had to reestablish, which I think the number one thing that most of us overlook is a closed vertical before we start. That's what I mean when I say sandwiching a crown into a maloccluded dentition, right? If you were doing an implant in the area of the lower right molar and it had been missing for some time and the upper right molars had extruded, that would be obvious to you, correct? You would know that either you got to intrude those molars before you do an implant or you'll end up with a little peg nothing. And some of you have done that before. So have I. I look back. Well, that's actually when I had somebody come in and do implants for me 35 years ago. But that's what I mean. You have to look at the vertical dimension. Do I have to address that? If it's a pretty healthy mouth, it's not going to win any awards of beauty. And you got one more crown that needs to be done, and it's not going to be perfect, but it'll be okay. There's some guidance left, anterior guidance on this patient. I'm not asking you to recapture the vertical of every millimeter, but some patients, it's quite obvious. And this guy that I'm speaking of, I had to treat both maxillary and mandibular dentitions. And in some cases, by the way, I deliberately would recapture his vertical with composite to save him money, and I told him so. That was on the mandible, where aesthetics were not as critical to this particular gentleman. You know, maybe somebody would hear me in that presentation and go all the way. Maybe it could have been a $60,000 treatment plan. I tell the patients, I really try to be conservative if and when I can, meaning I don't want to waste your time. If I do something and it falls off in 6 months, and you paid me for it, not a good idea. So it was very clear that he needed full coverage on his upper teeth, on like 10, 12 teeth. 12 teeth. His very back molars, composite. Sure, certainly. So let's just review what I've talked about. I told you about red flags. I told you about when somebody doesn't have they have a missing front tooth. It's a red flag to me. I immediately want to know why. I do. If they tell me the answer is insurance, I'm not going to get up and walk out the room, but I know I have a lot of educating to do. And even if I do it all, I very, very am likely to hear from my financial coordinator that they're going to try to find a sponsor and no commitment was made. And that happened a couple times on this particular week, by the way. It did. I had another gentleman in with a terminal maxillary dentition. Not even close. Nobody in the world would restore that to case. And gave him the things you always hear me talk about. I used my 3D models to show him conventional dentures, all the implant retained prostheses. And I was kind of bummed because I couldn't get a feel for why he was in that condition for so long. And I really took a lot of time. I have to tell you, there's been way, way more times than I can recall when I thought this case had no hope to be accepted based on the condition of their mouth as I was approaching it. Because my thought was, if you could have done something, you would have done something by now. So either money precluded it, the cost precluded it, or fear. Now, fear is a great thing for me because of the sedation. I have a couple more cases I'm going to share with you next week, but I don't like to make these more than 30 minutes. So again, look at your patient. What's going on? Is there any red flag? If there's not, proceed the way we've talked about in the past. If they have no significant dentistry, it may be a time to talk about good old Joe. Because you got to remember, most of your brothers and sisters in the industry, it's a sad case, but it's just true, don't embrace comprehensive exams. They do embrace fixing the problem that the patient has that particular day or that particular year. And I'm not trying to sell people stuff. I don't want you to sell patients stuff. I want us both to aspire to the top oral health that patient can afford. So that's why soft tissue care is always in every treatment plan I do. It is never acceptable for somebody to ask me, do they really need quads? No, they don't really need quads. I put it in there because I wanted to get more money. Of course they needed quads. That's why it's in there. And by the way, they also needed the 4-month recall that I told them they're going to be on, which insurance isn't going to pay, et cetera, et cetera. I don't know. I hope this helped. I'm not done. So I'm going to pick it up next week and talk about the 4 personalities that you come across, and then how should that impact you? And here's your homework. Look up the author, Tony Alessandra, Non-Manipulative Selling. It came out in 1992 by Alessandra, Alessandra, and I think Wexler. And in that book, I don't want you to do any selling. I want you to be an educator that's enthusiastic about what you do every day and feel fortunate to have the job of as a dentist, that you picked, that you chose that road and you love it. That's what you're selling. You're selling that vibe. But in that book, it talks about the 4 personalities, the relator, the socializer, the driver, and the thinker. And it's kind of a fun thing to read anyway, because you have people in your life, let alone patients, that own those personalities, including you. So have a great week. Let's keep rolling. And hit me with the emails. I love it. I really do. See you soon on a Lionhearted Dentist.